Hi, my name is Andy Molloy. I'm a consultant orthopaedic surgeon specialising only in foot and ankle disorders here at Spire Liverpool Hospital. So today I'd like to talk to you about ankle ligament injuries or sprains. So the ankle ligaments provide stability to the ankle so that we have a stable platform to push off on either walking or running. Now, there are three main ankle ligament complexes. The first is the syndesmosis, and this is between the shin bone and the outside bone. The second is a single large ligament on the inside called the deltoid. And the third, and the one that I'm going to focus on today, are the three ligaments on the outside which make up the lateral ligament complex. And these are the ones which are the most commonly injured. So an ankle sprain is where the ligament is stretched or torn. And ankle sprains are about the most common athletic injury, accounting for around 40% of injuries. So patients can injure these from things such as simple as walking and tripping over an uneven surface to playing sports and such like. So to assess the ankle ligaments and decide how we're going to treat them, we need to grade them. So the grading system has three parts. A grade 1 is where the ligament is stretched but not torn. A grade 2 is where the ligament is stretched and partially torn. And a grade 3 is when the ligament is fully torn. So as I said, the treatment of these depends on the severity of the sprain. So for a grade 1 sprain, these will normally get better with relatively simple measures. And the easiest method of treatment to remember is RICE. And this stands for rest, ice, compression, and elevation. Would also recommend that patients avoid carrying out any activities which put undue stress on the ankle during this time, but these should settle really relatively quickly. As we get to grade 2 and grade 3 injuries, there is progressively more tearing of the ligaments, and it is a more severe injury. Now, patients with these will tend to find that there is sudden onset pain and swelling, with that swelling deteriorating over the next 48 to 72 hours, and there will be difficulty in putting the foot to the ground. So if patients have these injuries, I'd strongly suggest that they sought medical attention for further ongoing treatment. And this is because, as well as ice, frequently bracing is required to help keep the ankle in the correct position and to help prevent further injury to the ankle ligaments and the ankle joint. Physiotherapy is also crucial for this. Now, the aim of physiotherapy is to work on the strength and range of motion of the ankle, but will also concentrate on giving patients back good balance on this side, which is critical for ongoing function afterwards. Now, however, in spite of even the best treatment, around up to 10% of the grade 2 and grade 3 sprains can go on to have ongoing instability. Now, what this means is that the ankle can feel unstable on simple activities of daily living or on sporting activities, and it is thought that there may well be an increased chance of arthritis with ongoing instability. So in patients who have ongoing instability, surgery may well be indicated. Now, traditional surgical methods for this involve 6 weeks in a plaster followed by 6 weeks in a boot. However, the technique that I use and that I've published on is done in a very strong way using keyhole surgery and then using special screws with stitches attached to them so that we can accelerate that rehabilitation regime. And this means that patients can progress to weight bearing in a boot at 2 weeks and can start early physiotherapy then, even leading on very quickly to going onto an exercise bike and maybe into the pool and such like. And this means that hopefully by 9 to 12 weeks, patients are back doing sport-specific activities, which is far accelerated from traditional methods. So to conclude, ankle ligament injuries are very common and about one of the most common athletic injuries. The majority will be treated very well with simple methods or even ranging up to needing a brace or physiotherapy. However, a significant proportion of patients will have ongoing instability and problems. For this, the technique that I use and have published research on has got an accelerated rehabilitation program and has an excellent success rate.